Welcome to the talk on depression and anxiety. I would like to introduce Deborah Berryman, who's the Divisional Director of Adult Outpatient and has been employed at Southside Behavioral Health since June of 2003. She graduated from Longwood University with a Bachelor's of Science in Social Work and continued her education at VCU with a master's degree in social work. A resident of Mecklenburg County, Deborah works in the Clarksville office, and today she's going to talk about depression.
Christy, thank you for that introduction and for inviting me to talk about depression today. We've seen a significant increase in depression, substance use disorders, as well as anxiety with the pandemic, and we anticipate that the numbers will continue to grow, unfortunately. Some numbers I'd like to share with everyone is, according to the National Alliance on Mental Illness of Virginia, major depressive disorder is the leading cause of disability in the US and Canada in adults aged 15 to 44. Every 12 minutes, one American dies by suicide, and in Virginia, the rate of suicide in 2016 for the general public was 16.9 deaths per 100,000. And unfortunately for veterans, it was higher, 23.5 deaths per 100,000. The Substance Abuse and Mental Health Services Administration reports that 12.2 million adults aged 18 or older in the US reported having serious thoughts of suicide, and 1.2 million actually attempted suicide in 2020. People often use the word depressed to describe feelings of sadness, and grief, and just an overall mood. However, in behavioral health, we use the Diagnostic and Statistical Manual of Mental Disorders to diagnose based on symptom severity, frequency, and duration. There are many types of depression, but I wanted to focus just briefly today on major depressive disorder. An individual must have 5 or more of the symptoms during the same 2-week period that are a change from their normal functioning. And these symptoms cause significant impairment in all areas of an individual's life. At least one of the symptoms must be depressed mood or loss of interest. And with depressed mood, we see that for most days, nearly every day, with crying spells or feeling like crying, thoughts of dying or wishing to be dead. Loss of interest includes loss of motivation or enjoyment in activities. Some of the other symptoms include loss of appetite or eating too much, and weight gain or loss without trying to lose weight or gain weight. Difficulty falling asleep or staying asleep or sleeping too much, moving slowly or having really restless movements that are uncontrollable. Lack of energy, fatigue, feeling hopeless, helpless, worthless, feeling guilty for no reason, or like people would be better off if you weren't here. And difficulty concentrating or making decisions. We know that individuals who have a family history or a previous diagnosis of depression or other mental health and substance disorders are also at greater risk of depression or developing other types of mental health or substance use disorders. Certain psychological and social factors also contribute to the symptoms of depression. We know that traumatic events, both past and present, significant losses, whether that be your job, your home, your health, a relationship, death or serious health issues in partners, family members, close friends, even pets. Victims of abuse, whether it be emotional, physical, sexual, or neglect, bullying, victim of a crime, and chronic physical illnesses or pain and certain medical conditions such as traumatic brain injury, stroke, thyroid disease, Parkinson's disease, and hormonal changes, actually both during and after childbirth, certain side effects from medication, substance use, and chronic poverty and homelessness. Essentially, depression is when we have changes in our neurotransmitters, which are the brain chemicals such as serotonin, that send messages between our nerve cells. The good news is there is treatment and there is hope. We know that psychotherapy, or what most of us know as therapy or counseling, and medications and usually working together help a person with these symptoms. In counseling, we use evidence-based practices such as cognitive behavioral therapy to recognize negative thoughts and to help a person change them, and antidepressants, mood stabilizers, anxiety medications, and certain sleep medications also help with the symptoms of depression. For treatment-resistant depressions, to the depression that does not respond well to the therapy and the medication management that we typically do, there is a treatment called transcranial magnetic stimulation and electroconvulsive therapy. An individual can decrease their symptoms of depression by increasing their activities, decreasing their isolation, so socializing more, getting out more, managing their stress, using relaxation techniques, having a healthy diet, exercising, having a good sleep routine and good sleep habits, and then decreasing alcohol and substance use. Some resources I'd like to share with you today. SAMHSA has a national hotline, helpline, which is 24/7 treatment and referral information services. The National Alliance on Mental Illness of Virginia offers support, education, and advocacy. And Mental Health of America of Virginia also offers advocacy, recovery, education, and support. And they have a warm line. A warm line is a number that anyone can call and get support and receive information. And most importantly of all these numbers that I've listed is the National Suicide Prevention Lifeline, 1-800-273-TALK. This number can be used nationally to get help for suicide. I'd like to spend a few moments, if I could, talking about the services at Southside Behavioral Health and what we do so that people know how and where to get help in our area. We are one of 40 CSBs in Virginia. Southside serves individuals who reside in Brunswick, Mecklenburg, and Halifax counties. We have adult outpatient services for both behavioral health and substance use disorders. We offer therapy, both individual and group, medication management, evaluation, nursing services, peer support, and a peer support warm line. The peer support is valuable, and I actually saw one of our peers on here earlier. Peers are individuals with lived experience. They are in recovery themselves from either mental health, behavioral health diagnosis, or substance use disorder, and they've gotten help and they know how to support individuals who are going through similar things that they have and offer that support. In adult substance use disorder services, we also have a wonderful program in our Halifax office. It's called office-based opioid treatment. We call it OBOT for short. Individuals who are addicted to opioids and need help and want help, we have medication that we can use to replace the opioids. We use buprenorphine, Suboxone. We provide that in conjunction with therapy and peer support services and nursing services. And we also offer drug court treatment for individuals who are incarcerated and need treatment rather than incarceration to help with their substance abuse issues. So we're fortunate to have that program in Halifax as well. We also offer adult community-based services. We have mental health and substance abuse case managers. We offer mental health skill building, psychosocial rehab, permanent supportive housing, and forensic services. Our crisis services provide 24/7, 365 days a year of crisis intervention services, pre-admission screenings if an individual needs to be assessed to determine if they need a psychiatric inpatient hospitalization. We offer crisis assessment centers and mobile crisis response team. And our mobile crisis response actually goes into the community, meets the client where they are, the individual and the family, and talks to them and provides those services. And the goal is to prevent hospitalization or to prevent further crisis. We also have children and family services, and they offer all the same services that we do in adults, with the exception of a wonderful program that was just started recently. We offer school-based services. We have therapists in the school systems in Mecklenburg, Brunswick, and Halifax counties. So we're there meeting the children where they are and where they need to be seen. Also, pretty soon we're going to have case managers working in the school system as well. So we're excited about that. We also offer intellectual disabilities and developmental disability services, support coordination, case management, day support, waiver, residential, community engagement, and coaching. And we have early intervention, which is support coordination, occupational, physical, speech therapies for infants with significant health issues. And Keenan and Amy, I think, are on here, and I would like to give a huge shout out to our prevention team. I gave them their own page because they do such a wonderful job of spreading the word, providing training and education in our communities. These are just a few of the things that they offer to individuals, to agencies and organizations.
Yes, I'm here.
Talk Saves Lives, Mental Health First Aid, Safe Talk, Assist. They're all suicide prevention training. Lock and Talk of Virginia, Revive, which is the opioid overdose and naloxone training, and ACE, which is adverse childhood experiences. Keenan Tyner-Smith is our prevention manager. Her contact information is listed here. So please reach out.
Should I follow up on it?
Sorry, please reach out to Keenan if you have any questions or if you would like to talk to her about any of these trainings and how to get these trainings. Here are a few important numbers for Southside. We have a centralized scheduling number for appointments, 1-833-272-2778. We also have our peer warm line, which operates Monday through Friday, 8:30 a.m. to 10 p.m., 1-833-826-PEER. And you'll be able to speak with a peer, get support, and talk about what may help you with your recovery and wellness. And then, of course, crisis services. Our number is 833-377-7272. We offer 24-hour a day, 7 days a week coverage for emergency services. And thank you. This is my contact information, and we'll take some questions at the end.
Thank you so much, Deborah. That was super helpful. I really appreciate your time and expertise. And Nina, if you want to go ahead and share your screen, I will introduce you. Nina is a fourth-year doctoral student in the clinical program of behavioral medicine at BCU College of Humanities and Sciences. Originally from upstate New York, she earned her undergraduate degree from Columbia University and currently resides in Chesterfield. And today she's going to speak about anxiety.
Yeah, thank you so much. So I'll be talking about anxiety and mostly giving a brief overview of what that looks like and how to know when anxiety is becoming a problem for you. So for some background, anxiety is really common. A lot of people experience anxiety on a daily basis, and it's actually a normal response to stressful situations. So a couple of examples here. A lot of people feel anxious in traffic, having a stressful day at work, conflicts with people you care about. It's normal to feel anxious in these situations. Anxiety is only really an issue if it's starting to become overwhelming or if it's getting in the way of you living your everyday life. And when that becomes the case, then this may warrant a diagnosis of an anxiety disorder. And that's something that a doctor can help you with. And that's also pretty common, not quite as common as just experiencing everyday anxiety, but still nearly 30% of adults experience some sort of anxiety disorder at some point in their life. So what does anxiety look like? Again, since most people have probably experienced this, I'm sure everyone is familiar with it, but let's go over a couple of the symptoms. Elevated heart rate, hyperventilating, so breathing really quickly or feeling like you're not getting enough air in your lungs, having racing thoughts or feeling like you're thinking about everything all at once, excessive worrying or worrying about too many things all at once, some stomach discomfort or nausea, difficulty concentrating or having a hard time focusing on one thing, maybe having your thoughts jump around a lot, some irritability or feeling like you have a short fuse, trouble falling asleep or trouble staying asleep, sometimes related to racing thoughts, although there can sometimes be some variation there, and maybe even some muscle tension. And you can actually see that a lot of these symptoms overlap with the depressive symptoms that Ms. Berryman was talking about before. So why do we get anxious? Anxiety is actually related to the fight or flight response that I'm sure many people have heard about. And this is a response that is meant to keep your body safe from harm. So this happens when you're in a dangerous situation. Your body will activate a bunch of different systems to get things moving more quickly. So your muscles will tense up so that if you need to fight, you can do that. Or if you need to run away, your legs will be able to get you out of that situation in a timely manner. You start breathing more quickly to get more oxygen to different parts of your body. In the same way, your heart rate increases to try to get the blood to different parts of your body and make sure that there's nutrients there. And so you'll see that a lot of things are happening more quickly. And you can also tie this directly to those anxiety symptoms like the hyperventilation, feeling like your heart rate is increasing, the muscle tension. And a couple of things slow down too. So for example, digestion shuts down because that's not really as important when you're, needing to keep yourself safe. And that's actually why you might experience some nausea or stomach discomfort when you're feeling anxious. So again, the fight or flight response is really important and it's going to keep you safe in a lot of different situations. But sometimes there are false alarms that will set off the fight or flight response, even when it's not really appropriate. So, if you see like a bear in the woods, very appropriate to feel that fight or flight, very appropriate to feel anxious. Maybe a more reasonable example in our day-to-day life, if you're like crossing the street or something, you want to be a little bit on edge, maybe just to keep yourself safe, keep yourself aware of the surroundings. But if you're maybe trying to get into your inbox, clear out some emails, or trying to respond to phone calls, it's not going to be quite as helpful. You can't necessarily punch your emails. It's not going to help you out there. So how can we cope with this anxiety if the fight or flight response isn't really an appropriate response to what we have going on? Well, one really helpful thing to do is practicing things like deep breathing. So you can see that hyperventilation is one of the symptoms of anxiety. So actually slowing down your breathing and breathing really deeply with your whole chest is going to actually like inverse the response. So you're going to slow things down. You're sending a signal to your body that this is not what I need right now. I actually need things to start going more slowly. I need to calm down so that I can resolve the issue in a more logical way. So the way that you know that you're really breathing deeply is I like to do this exercise shown here, where you can put one hand on your chest and one hand on your belly. And when you breathe in, the hand on your chest should go up. And when you breathe out, the hand on your chest should go down and the hand on your belly should go out. So kind of like pictured here. And try doing this really slowly. Count to about 4 or 5, whatever helps you feel like you're really getting a slow, deep breath going. And I've actually included a few more links to some other relaxation exercises in the PowerPoint. And I think we'll be putting those up online. So if you download that, you can find those links there. And some other next steps, again, anxiety can be really normal and it can be helpful in those situations where you need to keep yourself safe, keep yourself alert. But it can become a problem if it's overwhelming and getting in the way of your life. So if you're feeling like that's the case, that it's getting hard for you to do the things that you want to be doing, then it's a good idea to talk to your doctor about ways to manage anxiety. And they can recommend either medications or cognitive behavioral therapy, or there are a few other therapy options. And they can be really effective for managing those anxious symptoms. And Dr. Parker at Community Memorial Hospital is the psychiatrist there, and he's been really good at helping people manage their anxiety, and he's been referring them also to our adult telepsychology clinic, where we work with them to continue resolving those symptoms using some of those psychological methods. Yeah, I think that's it. Thank you.
Wonderful. Thank you, Nina. That was very helpful as well. If anybody has questions, you're welcome to put them into the chat, or you can ask them by unmuting your microphone.
Hi, Nina. This is Christy Mosley. I'm the practice manager over here at Behavioral Health, and I appreciate you and Deborah both today. So as a parent, I have a child who 22 years old. There's some anxiety in her life and different things. As a parent, my personality is I'm kind of a driver, a little, I don't want to use the word hyper, but for lack of a better word, I'm pretty much a driver, and my daughter loves to say I manage her, so to speak. Any advice for me, either you or Deborah? Just, I'm 50 and just still kind of in a go-go mode constantly. Any advice for someone who's trying to support a young adult child with anxiety? She's doing really great. Don't get me wrong. She's in school full-time, works full-time, that kind of thing. But just everybody presents stuff that really helps the patient, so to speak, but just for me as a parent.
Would you like to take this first, Ms. Berryman?
Sure, I will go first. Hi, Christy. So as a parent, we tend to do this. I think it's just a normal instinct of a parent. I would say that you have to make sure that you keep yourself in check and your anxiety in check and your worries and fears, because what happens if we have all of that and we're approaching our child with that, or our young adult with that, it's going to carry over and they're going to feel some of that. I think, like Nina said in her presentation, we really worry about anxiety and depression when they become really disabling to a person, when the person can't function normally, when it prevents them from doing normal activities. And that's when we would encourage them to see their family physician maybe first, or talk to someone and see how to get help. And if a help is even needed, because as Nina said, sometimes anxiety is very helpful. We all need it and use it. But when it gets in the way of our normal functioning, we may need to get some help for it. I hope that was helpful.
Yes, thank you, Deborah.
Yeah, I'll add on also, I think that communication is also really important. And I think that teens especially really like to be treated like adults. And if you are noticing that there's some behavior that she's showing that's concerning you, or you think that there's a different way that she could be handling a situation, it's helpful to just tell her that, in a way that lets her know that you're coming from a place of love and support. Because I think that she'll appreciate it, and it's a lot of times it's more helpful than either waiting for things to resolve on their own or kind of brushing things under the rug.
Thank you, Nina.
And we have a comment in the chat if Deborah can mention the conference that's happening tomorrow. Oh, she's responded.
It is okay. I'll mention it, and I typed it. We are having a trauma conference, a 2-day trauma conference starting tomorrow. Our executive director, our prevention department, our marketing department, and others have gotten together and worked on this for many, many months now. We have Dr. Bruce Perry speaking, which is so exciting for many of us. You can go to our website, Southside BH. Thank you, Amy. She just posted it, southsidebh.org, and register. It is free and it will be wonderful, I promise.
Great, thank you. Anybody have any other questions? We have about 4 minutes left. We have a question, is the conference in person?
It is virtual. So you can do it from the comfort of your office, your living room, wherever you want to do it. So we are offering it virtually.
And we've got a question in the chat. I have heard anxiety can feel like a heart attack. How can one tell the difference?
Yeah, I think if you're concerned about your health, it's always good to go to a doctor. If you think that there is something really serious going on, it may be appropriate to go to an emergency room. Sometimes it is possible for you to feel like you're having a heart attack or feel like there's something really serious going on, and it can be related to anxiety, especially people who have panic attacks. This can be the case. I think that it's good to rule out those physical conditions, because you don't want to tell yourself, oh, I'm just being anxious, when there might be an issue. So it's definitely good to check in with the doctor, make sure everything's okay. But if it seems like things are going all right, there's no physical condition that you're aware of, then relying on some of those relaxation techniques and seeing if they help, that can be a good way to kind of distinguish between is this a physical condition or is it more psychological?
Great, thank you. Any other questions? All right, I don't see any, but thank you all so much for your attendance, and we just appreciate you being here so much. Thank you to Deborah and Nina for presenting. And again, I will post the recording and the presentations on our website and Facebook. Thanks, y'all have a good day.
Thanks, everyone.
Yeah, thank you. Bye.